Hi, this is Dr. Renee Gasgarth with Dermatology Plus Plastic Surgeries podcast for your best self. And today we're going to talk all things lips. So this is your Lips 101. We're going to talk lip plumpers. Yes, I mean those lip glosses that you see everywhere. We're going to talk lip flip, lip filler, and lip lift. And if you don't know what any of those are, well, you're going to learn today and hopefully it'll be fun. So interestingly enough, every time I talk to people about lip filler, someone always says to me, well, what are you doing to get people not to have those crazy lips? So we're going to talk about trends and the risk of lip filler as well. But we're also going to talk about alternatives. And so what I think is really interesting is that everyone acts like this is a new phenomenon. Everyone acts like, oh my gosh, the Kardashians made everyone want to put stuff in their lips. And I do think that Keeping Up with the Kardashians has had a huge role in popularizing a lot of plastic surgery procedures, getting people more, essentially more open to communicating about their goals, what they've had done. And in some ways, it's sort of normalized it. But what I remind people is that some of our earliest information about the cosmetic industry had to do with lip staining. As early as 3500 BC, an Egyptian queen was known for making her own cosmetics for her lips. And she actually used crushed lead, so we don't recommend that. It's definitely not safe. And, you know, there was a time when only prostitutes wore makeup, but for a lot of society, it was a way of showing that you had the money and the time to really express yourself. And if you look at times of sort of trauma or difficulty, there's a phenomenon called the lipstick phenomenon, where even when people are going through struggles, there's an increase of sales of things like lipstick. And so you can track sometimes what the economy is doing by looking at cosmetics like L'Oreal and seeing where their trends are. And interestingly enough, they found that in almost always, except for COVID, and we'll talk about that predicting a recession, usually you can start to see an increase in cosmetic sales of these brands that sell more affordable options, with the idea of our appearance is important to us. And so if you're wondering, well, why lips? Why are people interested in lipstick? I really think that has to do with that we're all looking for a way to connect with people. And they've done a lot of studies when we're looking about how to teach people speech, and for people who are deaf in particular, and also now with all of the research for facial recognition software. And we found that when people are having a conversation, 30 to 40% of the time they're spending looking at someone's eyes, and 30 to 40% of the time they're spending looking at someone's lips. And the rest of the time they're sort of gazing all over their face. And that's when they're doing direct visualization. So the lips are usually what we're looking at when someone's communicating to us. So when we're speaking, we look at their eyes and looking for to relate to them. But when someone's giving us information, we look at their lips. So I don't think that this trend is new. I don't think that it's strange. I think it's a way of us feeling good about ourselves in a way that's very visible and a way that we make connections with people. And so take all that aside, lip filler is a huge proportion of my injectable practice, and I'm happy to do it. I think the anatomy of lips is interesting, and I think everybody is different. And so it's a way to sort of really tailor a treatment to someone, but it's not for everyone, and there's lots of other options. So we're going to start with lip plumpers. And interestingly enough, I get asked all the time, do these work? And the answer is yes, they do. So lip plumpers, these lip glosses, and I brought my favorite because I use it. I like Buxom. And then I brought my Skin Medica one, which we'll talk about too. But lip plumpers all have ingredients that cause some sort of inflammation or vasodilation, meaning there's some sort of process and chemical that brings increased blood flow, and so it changes the shape of your lips slightly. So the most common ingredients are from, believe it or not, hot chili peppers, from menthol, cinnamon, nicotine. So that is why if you use a lip plumper, you feel that tingly feeling. And people ask, is it dangerous? No, unless you have a food allergy to one of these ingredients, it's not going to hurt you. It's a topical, it's not well absorbed into your system, but not everybody likes that tingly feeling. That's true. And in terms of how long it lasts, well, basically you can feel the effects while the product is on, so you can feel the active ingredient, and then it should last a few hours. The main downside of these lip plumpers are, one, they don't last very long and you have to reapply them, and two, they can be very drying. So essentially we're causing something to swell and we're not necessarily adding or hydrating. And so they tend to make people sometimes feel like their lips are chapped after the effects have worn off. And so I really like the Skin Medica system. So it's a 2-for-1 system. The plumper has almost all of those ingredients that we've talked about. So they're natural ingredients that causes the plumping, but they have first a smoothing system. So that's hydrating. So it has lots of hyaluronic acid and other things that really make your lips soft and hydrated. And so for patients who want their lip filler to last longer, I think that this can be a really good system for people to use. And it is clear. And then I do think it lasts longer than things like the Buxom brand, because they've spent more, frankly, research and time trying to figure out how to get longer effects, and they use more ingredients. But they do work. So if you're happy with that, instead of doing lip liner, you can just put on your lip plumping, which I use for special occasions or for fancy podcasts, even though you may not be watching me. And I do think these products work. And so the next step for people, if they want to talk about their mouth and what we can do, is really talking about neurotoxins. So things like Botox, Dysport, Jeuveau. And that is I like to think of it as can help affect the whole area. So a lot of people do not know what a lip flip is. I think this is the hidden secret of Botox and Dysport and Jeuveau. And I'm a huge fan of it personally. I much prefer it over lip filler because I tend to really swell with lip filler, and being in the plastic surgery business, everyone knows when you first get lip filler, and then everyone wants to ask me many questions about what kind I use, which can sometimes get a little awkward because the truth is I vary. And I don't like necessarily that feeling of swelling that you have the first couple of days. So a lip flip is nice in that it's more subtle. So if someone's looking for just a little bit of a change in vertical height, and what I mean by that is that as we age, the distance from our nose to the top of our lips increases, but we also get an involution. So if you're making a kissing face, think about the opposite, where your lips are turned in a little bit. And that actually happens with age, and it has to do with both your bone structure. So we reabsorb bone. So our actual upper jaw, our maxilla decreases in size. We also lose soft tissue. So our muscles atrophy, they get thinner. And then we also have just loss of collagen. So it's really a process that happens to us as we age. And so people will say, I've lost my lip. What happened to my lip? And that really is happening. It's part of the aging process. And so this is a nice way to restore some of that, so that the part of your lip that you put lipstick on, so the dry mucosa, we call it, that you can see more of that. And then neurotoxin is also really good for softening those vertical lines. So we call them smoker lines, even though they are genetic, and it can happen if you don't smoke, and some of that is normal. So they can help soften those lines. And then it's also really good for people who have a gummy smile. So that is when your smile is so big and so bright, which could be considered beautiful, but you see a lot of people's gums. And in general, women do not like that. They feel like it looks like they have a horse mouth. So that those big gummy smiles we talk about, it can also help relax those. So all of these areas can be targeted, but it's really subtle, and not everyone wants subtle. Again, that goes back to our awesome podcast hosts' comments, like, why do people want their lips so big? So I tell people, essentially, you're looking at it like, instead of putting on lip liner, that's basically what a lip flip does for most people. The downside is that it doesn't last. So all of these neurotoxins, again, act on how the muscle cells talk to each other. And it has to do with fusion of vesicles, and your body just makes more of them. So that most times the neurotoxins last about 3 months. And the orbicularis oris is a strong muscle, and it's circular, and we don't want to weaken it very much. And that's essentially what we're doing to get some eversion. So it is going to wear off earlier. And the other downside is that people can feel like it's really strange for the first 3 days for sure, but sometimes it can last 1 to 2 weeks, and that they may feel like their smile is funny. Looking at your smile, it should not be funny. If that happens, you need to let us know. All my patients have my cell phone number. And you can feel, though, that it's difficult to drink out of a straw, which is true. Again, we're weakening how your lips make that round face. And so essentially not everyone likes that feeling. The next option then, if we want more volume. So volume is what I tell people, if you think about your lips as a 3D shape, there is actual shape to it. So that Cupid's bow that we talk about, you also have a philtral column. We can shape all of these things. There's also a vertical height. So how much of that area that we see the lipstick, so how much of that dry mucosa do we see? And then there's also projection anteriorly. So a lot of people think that lip filler gives you these duck lips. It should not. It should not. And I say that again, if you have duck lips, then you need to talk to your injector because something went wrong. So it's different if it's just swollen for a few days, but if the product has migrated so that it's behind your lips, that's what's going to give you too much of that anterior projection that's not in your lip itself. And that needs dissolving. And the nice thing about lip filler is, again, is that we use hyaluronic acid. So it is naturally made in your body, and it would exceedingly rare to have a negative reaction to it because, again, it's a product that's naturally made in your body, and we have an enzyme that can naturally break it down. So if you don't like it, we can always remove it by using the enzyme that breaks it down, hyaluronidase. And it provides a nice subtle decrease in how plump your lips are. So it's not like one day it's on and one day it's off. Your body's going to break it down. And we have such good technology now, so many types of hyaluronic acid that have really been developed for lips that we can really target what look you're going for. So if someone tells me, I really want a sharp Cupid's bow, or I want a keyhole, I would use a different product because I'm really shaping the lips. If someone tells me I just want my lips to look hydrated, so I actually like the size of them and the volume, but I feel like they're looking too wrinkly and I just want them a little plumper, a little smoother, I would use a different product. If someone's really looking for volume in all directions, so they need vertical height and they also want really pillowy, soft lips, well, that's probably 2 syringes, let's be honest. And I would use probably 2 different types depending on what their goals were. So when people think, oh, you can just get a Groupon or go anyone to do lip filler, I would tell you don't do that because you want someone that knows the anatomy and knows the whole range of products. And that's why I personally really enjoy lip filler. I think it's just interesting in terms of that I'm really trying to take your anatomy and help you achieve the goals you want, and everyone's anatomy is a little different. And so when I talk to patients about lip filler, I always get out a mirror and we talk about how your lips are currently shaped, and that has to do with a lot of things. Believe it or not, your teeth play a huge impact on how your lips are at rest. So often someone will say to me, well, my lip is fuller here, and I ask them to smile, and I point out that one of their teeth is actually more anterior, more forward in that spot. And they're like, oh, I never noticed that. And they just thought their lips were weird. I'm like, no, that actually is your teeth, and we're probably not going to fix that with lip filler. We can improve it, but that would really be braces if you want your lips to lay smoothly. And sometimes it's actually what they're seeing is a distance from their nose to their lip, which can be, believe it or not, because your nose is actually a little crooked. So that's why it's never a simple, for the first time we inject, it's never a simple come in and I'm just going to put something in your lips. I really do like to study the anatomy and think about it. And I think that's why I can do lip filler multiple times in a day and still be really interested in it, right? It doesn't get old. It's not tedious because everybody's lips and their anatomy is different. And so I do ask patients, I'm one of those people, I'm fine if you have a photo of what you're looking for, but it's not always obtainable depending on what your anatomy is. And so I definitely want people to understand that. And the other thing that I want people to understand is that hyaluronic acid naturally brings in water. So it always is going to cause some swelling. The products do vary in how much water they draw in and how much swelling. But when you see these pictures on Instagram that are before and after, the pictures that sometimes people are like, oh my gosh, that's terrible. Why would anyone want lips that big? It's not real. That is swelling and that's bruising. And so really, if you want to see a portfolio of someone's lips, you don't want to see the immediate after. You want to see what the lips look like in 2 weeks. That's when the vast majority of the swelling and bruising is gone. And so these pictures where it's one syringe, again, that's 1 milliliter. So if you think about a shot glass, that's 1/30th of that. That is not going to give you these huge dramatic duck lips. And people will also ask me a lot about Russian lips. So interestingly, the Russian lip trend is these sort of very pillowy, very large lips. That again is not 1 syringe of filler. And I want to caution people too, do you really want that? You know, so again, it will wear off, but we want to build slowly over time. And the reason for that is that, one, you can overstretch your lips. If you overstretch your lips, you can get essentially cuts and cracks in your lips, which can cause scarring, believe it or not. And it's also just uncomfortable. You get a lot of dry and chafing. Not to mention, if you're putting too much product into your lips in one setting, or one session, I should say, you increase the risk of getting these lumps and bumps that don't go away. So these lumps that don't go away, I do think the vast majority are due to the injection technique. So we take lip filler very seriously, like it's going to be an implant that lasts in your body. We prep you with special surgical soap, and we don't let you do any dental work 2 weeks after getting the lip filler because, again, we don't want it to get infected. But some of these lumps and bumps, when I see them from other injectors, happen because they were really trying to just bolus. So just put a lot of product in an area of the lip that they wanted it to sit. And that then is not natural. And your body's enzyme can't get to the center of that ball of product. So we don't want to do that. We want lips that are very soft, that are very pretty, and that look hydrated and natural. And we really want to build volume over time. And that's the other thing that I always want to tell my patients is that if you really have goals for these big lips, then it's going to be multiple syringes. So there's memes online where they're joking with people about the natural saga of lip filler. And it's like, day 1, what have I done? This is terrible. I hate it. Day 3, oh my gosh, it's still kind of swollen. It's lumpy bumpy. And day 5, oh, this looks great. I'm really feeling it. Yeah, there's still a little bruising, but it's amazing. And then, day 10 to 14, do I need another syringe? I kind of miss when they were so swollen. So I always tell people it's normal. It's normal to have that lumpy, bumpy immediately after swelling, bruising, some unevenness. And if you actually really like your lips on day 3 to day 5, then that's when we know we're going to do another syringe at the 1 month mark. But we don't want to do it before then because, again, I don't want to inject product into an area that has bruising. It can make it worse. And it also can make those asymmetries more obvious. And I also really don't want to give you any of those lumps and bumps. The other question I get asked is, what happens to your lips if you decide to stop doing lip filler? What happens? And so, again, your body naturally makes this enzyme that breaks it down over time. So your body and your lip mucosa is special, and so it should be able to shrink. So this idea of stretching out your lips and then having this loose, saggy lip skin really should not happen if you're going to a good injector who's not filling you like a balloon. It's not a tissue expander. So as long as they're building slow over time and you let your body naturally decrease the amount over time, you should still be able to keep that natural volume that you had before lip filler injections. And I used to get asked all the time, oh, Kylie Jenner, what did she do to her lips when they went smaller? And the answer is, I really don't know. I don't know if she dissolved small amounts everywhere but left some product in. I can tell you that her lips never returned to her teenage lip size. She really had no vertical height and had a lot of distance between her nose and her upper lip. So I don't know if they dissolved in small amounts over time or if they just let it wear off naturally. But I would tell people that the first step would be to just let your body naturally do it. So just stop doing the lip filler injections and just naturally let your body get rid of it. And then if you've had, over 2 years, every 3 months getting a lip filler and have a lot of volume, then my preference would be to dissolve small amounts evenly throughout, so that again we're not just taking out a bunch of product and that your lips don't have time to adjust and for them to contract. So if you're going to someone who knows all of these things, they're not going to put 3 syringes of lip filler in your mouth and then dissolve all of it and have it look miserable. And then the other question I get asked a lot about lip filler is they see these horror stories online. And I have to tell you that some people are not doing their due diligence in training on how to do lip filler and knowing the vascular anatomy. And they present themselves as like, this is no big deal. It's like lipstick. We're going to do it at a spa party. It's going to be great. And you do want to know the anatomy. So anytime you put a bolus of something in an artery, you can clog the artery, right? So that's why people get heart attacks. It's cholesterol plaques. That's why people have to have stents, in their arteries to reopen them. So if we put a bunch of hyaluronic acid into an artery, it will clog it. In general, your lips are very well perfused. You have 2 arteries and some smaller arteries that feed them. So it's very, very rare to get an ischemic event in your lips, meaning that you've put so much product in a vessel that it's cut off the blood supply to it, and those other arteries can't then provide enough blood supply to it. But it can happen, particularly sometimes people don't tell us that they've had surgery before, that they had a dog bite, maybe they didn't even realize when they were younger, and they don't have good connections between those arteries. And so you want an injector who can recognize it quickly and who knows what to do when it happens and who will act quickly. So if you are getting lip filler for the first time, I really encourage you to not do it at a party and to make sure you're in a space where they have someone who's trained, and they also always should have access to the hyaluronidase is what we call it, that can break that down, because that's the most important thing. So I once took care of a patient who's lovely, and she got lip filler and actually had decreased blood supply to both of her upper lips all the way up into her one nostril. And we injected the hyaluronidase, but if she had been my patient, I would have recognized it earlier, and that's the only thing, and I would have done that earlier. Instead, she was told it was bruising and that there's no problem, and so we were behind the game, and she actually had to do hyperbaric oxygen to really improve her smile. The muscle was weakened. So again, I do caution people, in general, this is very safe, very well tolerated, very low complication. But if a complication happens, it happens to you, and you want to make sure that your injector knows what to do, recognizes it, and can take care of it quickly, because that's the best outcome. And then in terms of lip filler instructions, so I want patients to be aware that there's, again, going to be some bruising and swelling. If you're worried that you're going to have problems with swelling, or you're worried about discomfort, then you can start to take Arnicon bromelain 3 days ahead of time. These are medications that are found naturally. We do sell them in our office, but you can find them at GNC, CVS, and they help decrease inflammation, bruising, swelling. And so if you start 3 days ahead of time, that can really help with some of that discomfort. During the injection itself, you're going to come in and we're going to numb you. So you're going to numb for at least 30 minutes. For first-time patients, I usually try to wait closer to an hour just to make sure it's as comfortable as an experience as we can give you. We're going to go over what your goals are, what I think is reasonable, and what we can obtain. And I will make suggestions about what type of product to use. Again, they're going to be hyaluronic acid based. And I will also make recommendations if I think we should add some neurotoxin to help with fine lines or eversion of the lip, depending on what your goals are. And then after you're nice and numb, if you're still worried and not comfortable, we can always do a dental block. So that's a small amount of local medicine that we place where the nerves are. You will be numb and a little drooly for a few hours. So this isn't everyone's favorite. So you don't want to get a nerve block and then go to dinner because people are going to think that something really bad happened to you in your plastic surgery office. But especially if you're going to wear a mask at work and you're not going to eat or drink for a few hours, you won't really feel anything. So you don't need to be worried about pain or discomfort because we have 2 ways to get you comfortable. I've never had a patient, I shouldn't say never because I'm probably going to get one this week, but I've never had a patient say to me like, oh my gosh, it's so terrible. I need Ativan or I need medication. I just haven't had that. It's not that uncomfortable. And especially after your first time, most people feel it's better than going to the dentist because you're going to walk away with really pretty lips afterwards. We always are going to ask you if you have a history of cold sores, and I will put you on medicine to take twice a day if you have a history of that, because when the lips are swollen and when there's sort of stretch on the tissue, you can be more susceptible to getting a cold sore. So that is one thing you want to be aware of. And if you start to have pain in one specific spot, you're going to increase that medication to 3 times a day, and you're also going to text me or call me as soon as you feel that, and we'll get you in and take a look. We don't want you to get a cold sore because that, again, can cause scarring, especially when the lips are in that sort of inflammation and edema stage. So again, it's not a contraindication. I do get asked that, but we are going to give you a medication to prevent you from having a problem. And then after we do the injection, I like patients to keep their lips hydrated. So Vaseline, Aquaphor. You don't want to use any of these lip plumping creams, again, because that causes more swelling, more inflammation. And you don't want to do anything that's really going to increase trauma to the area. So I tell my patients for 1 week, I'd like you to not do anything that makes the O with your mouth. So sucking, intense kissing, using a straw. We want to sort of let the product be where we put it, where we want it to be, and let the inflammation decrease. The other thing that I see patients do sometimes is they can't stop touching their lips with their tongue. So your tongue is more sensitive than your fingers, which is interesting, right? Because we don't walk around and explore with our tongue. I see you touching your teeth with your tongue right now. But your lip, when it has product in it, is going to feel lumpy, bumpy, and swollen. And so I tell people, try not to play with it. So don't bite it. You can cause more inflammation, and you can actually cause like a little lymphocele, and you don't want to manipulate it because, again, you can massage the product out. And we don't want to put anything heavy on it. So you don't want to put heavy ice packs on it or things like that. It stimulates your body's own collagen. So over time, you should need less product. Over time, again, you should have volume that's there that stays. The product itself, some of it may stay for a year, maybe even 2 years. But over time, some of the reason we see needing less and less and going more time between lip filler appointments is because it actually has made your lips make collagen, which is really interesting, right? So this is hyaluronic acid is in your body, and it makes your body make collagen. So we don't want to do anything that decreases that inflammation. So I personally tell my patients not to take ibuprofen. I don't do steroids for it. If you're have an experienced injector who's putting small amounts of product throughout your lip, the swelling should not be so bad that you need steroids. Okay. And if you do really have that kind of reaction to hyaluronic acid fillers, what I would tell you is that we're not going to do a full syringe at a setting. we will space it out a little more so you're not having such an intense inflammatory response. Steroids themselves are not good for you. They can make you feel bad. They can make you feel irritable. They can throw off your blood sugar. So when I came from Miami, I was shocked how many patients would tell me, well, my other plastic surgeon always gives me steroids. I'm like, that is really not good for you. If every 3 months you're getting a Medrol dose pack for lip injections, we need to figure out a different plan. So it would be very atypical to have so much swelling and things that I would need to give you steroids. And 100% you would be in my office, in my chair, and we would be examining because something else chances are going on. And so how long does lip filler last? That's another question. I tell people, once we get you to the volume that you like, so once we've adequately filled you and we've stimulated some collagen, it really should last closer to 6 months. But the reality is that often patients don't ever get to that volume and that look that they want. So again, if you like how it looks on day 3, day 5, day 7, we didn't really ever get you to that size and that volume that you liked. And then you're right, your lip filler is not going to even last probably a full 3 months because you really felt like it only lasted you a week. But again, that's not true. You just liked it when it was swollen. So you actually want more volume than what one syringe can do. So if we think about it as a building process, then after 1 month, we do another syringe. If you're happy with how that looks at 2 weeks, the product really should last 3 to 6 months. And people also ask me, well, that's crazy. How can it only last three months? How can it only last 6 months? And that's because, again, we're putting in a very soft product that's in an area that moves quite a bit. So I'm a chatter, I am a talker, so I will tell you lip filler does not last very long in me because I use my mouth all the time. And so some people just make more smiles, they're more animated, they talk more, and those are the patients. Or if you work out a lot, and so you have lots of activity where you're getting red hot, sweaty, flushed in the face, product may not last as long because, again, you're bringing in the enzymes and you're stimulating your body to break it down. But we want nice, soft lips. We don't want things to be hard. So when someone kisses you, they should not be able to tell if you have product in your lips or not. Should not. So if someone is kissing you and can feel product in your lips, then that is a reason to see your plastic surgeon again and to talk about it. Because if you have a nodule that can be felt by another person, that's abnormal. That is not normal, and we can do something about it. We can dissolve it. The other question I get asked, because again, some patients were getting lip filler so often that then they would switch to a different person and that person would make them dissolve it all. I don't do that to my patients. If you have a little lump or bump and you are okay with how it looks and it's not bothering how it feels, and you actually like the volume, then I personally, my practice, do not dissolve it. But you do have to be aware that if we inject more product around it, it can make the bump feel firmer. And it also, that bump itself will swell more when you're in the swollen phase. So it's just something to be aware of. If filler is misplaced, so you have those duck lips and it's behind your lip, I always start with first just having you more aggressively massage it. Unless I think it's an infection that's different, you should be able to break down some of that product. And I just had a patient who had that. She had migration of the product, which can happen. And again, that's why for a week I try to have you be careful what you do with your lips because we don't want the product to move out of your lips and back. And so I had her just massage it, and it really made a huge improvement, even though that filler had been placed almost a year ago. So that would be step 1. And then step 2, though, if we just have so much product migration, things are so uneven, things are so lumpy bumpy, that's when I tell people we need to dissolve it. I'm not going to inject you unless we start over. And you have to have in your head that the dissolving process is about as expensive as a syringe of filler. So it does cause swelling and inflammation, and you're going to lose your lip volume. And then we have to start to rebuild again. And that means that in a month, we start with 1 syringe of filler, and then we wait a month, and we basically start over. So that can be very disappointing to patients when they've spent a lot of time and energy getting to a size they like. But I can't fix a lump and a bump, and a lot of and migrated product with another syringe of filler. And I do get that asked a lot. Well, this is lumpy bumpy down here. Can't you just put more product to even it out? That's not how it works. The product doesn't stimulate the other product to dissolve. And if anything, you're more likely to have that swelling and that lumpy bumpiness look worse. So those are the situations if you really have migration of product or things are just so uneven and so firm, we have to start over. And that's why, again, I tell people you don't want to get a Groupon for lip filler. Regardless of what you think, there are complications that are directly related to how knowledgeable and how skillful your injector is. And so when we talk about synergy in facial features, I think your lips are really important. People are looking at them when you talk. It's a way of us communicating, and we want you to have an excellent result. So we want you to be realistic about what you can obtain, and we also want to minimize the risk to you. And just in my practice, I have patients come back after 2 weeks, and we take a look, and I take a feel, see if there's any residual swelling, bruising, make sure we don't have any asymmetries. And at that point, if there's something we're not happy with, we can talk about massaging the product again so your body can dissolve it, or we can talk about adding additional filler based on your goals. And then people do get lip filler fatigue. So again, if you're kind of never got to the volume you wanted and you're going to see your injector every 3 months, at some point it's just not as fun. And I get asked a lot, well, what else can we do? And the sad thing is that right now we don't have anything on the market that can really do what hyaluronic acid lip filler can do. I've seen patients from other countries come with silicone injections. So they actually use a silicone that's in a liquid form. So it looks like filler, and it's injected into their lips. And in general, that just does not age well. It's very hard to distribute the product nice and smooth and evenly, and your body makes a response to it. It makes some scar tissue. So over time, it makes a ball, and those balls then cannot be dissolved, and essentially you have to cut them out. So don't let anybody put Fix-A-Flat in your lips. And people also ask, well, what about silicone implants? I don't do that in my practice. And I will tell you, for patients that they work well for, it's great. They love it, but it works well for very few patients. And here's why. So your mouth, again, makes a ring. And so over time, you're always pushing things down towards your mouth, right? That's the purpose, speech, but also to eat and to move things into your mouth. So if you put a thin silicone rod between, again, that mucosa that you see where you put your lipstick and the muscle that's like a ring underneath, it's going to start to work its way down. And so migration of these silicone implants happens to everyone. Every patient will have it, and how much it migrates has to do with the size of the implant and your own anatomy and how you're aging. And it's really common to have it start to extrude through the inside of your mucosa through that what I call the wet mucosa. And the reason is because when you eat and talk, you're kind of traumatizing your inner lip. And so if the silicone is migrating as a rod down towards that inside and you have any trauma to it, it can't heal over it. And so it's very common to have people say, like, it looked great for a year and now it's in the wrong place, and I think it's starting to poke through the mucosa on the inside of my mouth. So that's why personally I do not do these silicone rods. I have seen patients who've had them, and I have to tell you, they looked fabulous and they looked great, but that's almost like a, yay, you won the lottery, you got lucky, that's awesome. It's not the typical course for patients. Most patients will end up getting them removed at some point, and they form scar tissue, a capsule around it, so it's pretty traumatizing to the lip, and you'll lose even more volume if we have to take it out in a delayed fashion. Not to mention, you can't just pull it out, so you have to make a scar, and you're really digging it out, which can cause a fair amount of asymmetry and trauma to the lip. So I tell people to really think about that and make sure if you are going to do that you're going to someone who's doing it regularly and is comfortable dealing with all of those problems and knows what to do if it's migrating. And if you do have one that's migrating, you can absolutely come and see me and we'll talk about the process of removing it. People ask me sometimes, can you re-sling it? Can you put it back where it's supposed to be? And the answer is no, you cannot. It's not like enough room in an area to close that and put it in a new plane. It doesn't work. So you'd have to take it out and then potentially try to put it back in a delayed fashion, maybe in a year. And then the last thing we're going to talk about is, again, for lip filler fatigue, a true surgical lip lift. So what I always tell patients is that the lip lift can be really great in selected patients, but it's 100% not for everyone. And the reason is that it's never going to give you that kind of volume that you got from the lip filler. So if your main problem is that you feel like you just can't see your lips anymore, and you feel like the distance from your nose to your lips is getting too long, then yes, it's perfect for that. You make an incision. I should say there's two methods, which we'll talk about. I make an incision up by your nose. And so the risk is that as we're dissecting down and we're lifting, that you can have some persistent numbness of your upper lips, which can be very annoying. And it should not weaken the muscle itself, because this is a skin-only surgery. So that would be a very uncommon and a complication. But that is one of the risks, that your smile is uneven because the muscle itself got weakened. The nerves to the muscle are underneath the muscle, so as long as you're staying on top of the skin and dissecting carefully and meticulously, that should not happen. The scar around the nose, again, because you're moving your mouth so much, can tend to be a little wide. So unfortunately, it is common that people need some sort of scar treatment. That could be a revision of the scar, that could be laser to help lighten the scar, and that could even be steroid injections if the scar is getting a little raised. So this is, again, not something that you want to go to do someone who's never done it, never seen it, and isn't sure about it. And it's really a surgery of millimeters. It can be done while you're awake and in the office, lots of numbing medicine, and then essentially making markings, which is the most time-consuming part of the procedure, and then lifting your lip. And it'll give you more upper lip show. There are people who make incisions all the way around the course, so basically where you would put your lip liner. That is more likely to give you bad scarring that affects your mouth. So that's why I don't do that. That's more likely to give you some lumpy bumpiness or some contour abnormalities. We found that from patients, for example, with cleft lips or with injuries, that at a speaking distance, so even close to 6 feet, if you have 1 millimeter step off in that vermilion border, so where the white part of your lip meets the colored part, that you can see it. And so that's why I don't recommend for my patients having that incision go along that border, because I think that you're more likely, if you have bad scarring, to have a difficult time camouflaging it or treating it. You would have to retreat the whole area. And so that's why I recommend doing the incision that's underneath your nose. It's better hidden in the shadow, and it should heal better in terms of when you're smiling, talking, speaking. And then the last thing I'll say about sort of the lip lifts that are surgical is that it's very popular for some reason in Brevard County for people to get these Commissure Lifts. And so that is, if you feel like the corner of your mouth is turning down, what can you do to raise it? And so what I tell people, again, is your lip is a circle, and the connections from your upper lip meet your bottom lip in the corners. So I never recommend trying to address that by making an incision like a triangle around the corner of your mouth, because again, if you have bad scarring, that's going to affect how you speak, how you eat, how you suck in a straw. And most patients don't need it on the top and the bottom. They really just need it on the top. And so if you needed both, if the corners of your mouth were really indented, we'd want to think about two things. One is that was filler just overfilled in your lips? And so that we're actually missing soft tissue support from behind your mouth because it can't support how heavy your lips are. And I have seen that happen, in which case we're going to put lip filler, essentially the same kind of filler, around the corner of your mouth to really support that. And then the other question is it really just aging and that your anatomy is doing that? In which case we would just do part of it and then in 3 months do the other part if we really needed to. So I think that in the right patient, this heals beautifully, and I can do something that turns that frown upside down. So we call it like RBF, right? If you want to get rid of that, then we can do that with surgery. But the first place to start that I would always say is to try some filler first. Make sure you're happy with how it looks and how it animates. And that surgery for that should really be a last resort if you're having so much fatigue from your lip filler. But if you have a good injector who knows the anatomy, who makes you comfortable when you do the injections, it really should not be an unpleasant experience. It should be sort of satisfying, because that's the benefit of lip filler. You can see it right away. So just to kind of recap, we've talked about lots of options for your lips. The goal is not to give you huge, crazy, looks like you have a Halloween costume on lips. The goal is really to work with your anatomy and to help you achieve a very pretty, natural result. I will tell you that between patients and between ethnicities, there's a lot of variation in how big your upper to your bottom lip is and how much volume you have. And so as long as we keep that in perspective, that we want to keep it natural, your upper lip should never be bigger than your lower lip. It can be, in some cultures and some standards of beauty, the same. So the same amount of volume in your upper as your lower, which I'm fine with. But you have to realize that for most people who are in the United States, that then will look like you've had lip filler done, because most people don't have lips that are perfectly top and bottom even. Most people have their upper lip is about 2 to the bottom lip being 3. But the standard of beauty now for a lot of is a little bit fuller on the top than that. And so if you have an injector who knows these things, who can talk to you about it, and who's building over time, you should have a really pretty, beautiful result. No one should ask you, oh, you got lip filler. It should not be like that. They should just think like, wow, your lips look great. And if that's not right for you, then again, these lip plumpers do work. You just want to make sure that your lips are staying hydrated. We can also talk about using neuromodulators to soften some of those wrinkles, to give you a little bit of vertical height. Again, you want to think of that as more as a lip liner than a true changing of shape or changing in volume. Lip filler favorite, love to do it, happy to do it, come see me anytime. And then if you really want to explore all your options, we can always talk about doing surgery for, again, that's the surgical lip lift, and there are lots of options for that too. And if you have any questions, I'm always happy to see you in the office. Again, this is Renee Gasgarth with Dermatology Plus Plastic Surgery, and we're here talking about all things lips, Lips 101. Have a great day.